So, hi everyone. So, it is such a pleasure to be able to connect to you in the morning every single day. And today we are in the next episode of Transform that we do every morning at 10 a.m. I know, some of you are saying, Sir, 10 baje to uthte hain. But that is the entire point. We want to make sure that you get up at the morning and you start. This should be the moment where you should be on your table and start studying. And as promised, today we have kept a very important topic. I'll ask Deepti to elaborate.
Yes, absolutely. A very good morning to all the dear bachas. And, as we promised in the yesterday's session, we talked about the GT scores. Today, we are going to talk, what me and Dr. Sumer think are one of the most important MCQ solving skills and common problems that bachas face when they solve MCQs. So, what we will do is first, me and Dr. Sumer will tell our, insights and inputs, and then later we will start taking your queries as well, because I feel when we answer, when we start, we will automatically be answering your queries, है ना? So that's is very very essential कि हम पढ़ाई तो कर रहे हैं, but are we also focusing on the MCQ skill or not?
So first and foremost, I will start with the students who are, right now starting their study. Suppose right now you're in second year MBBS or third year MBBS. What difference will, how your study methodology will differ if you're preparing for an MCQ exam versus a theory exam? So whenever you're writing, the point number one that I want you to know is, whenever we are writing a theory paper, the skill that you need is descriptive. So you might get a question on write a short note on silicosis. So then you will write whatever you know about silicosis in the it is due to occupational disease, it is due to this, it will involve this, and you will write those things in the your answer sheet. So people
Dr.
are good
Samir,
at descriptive.
I would
People who
just
are
add,
good at descriptive ability are
yes,
usually doing better in a
I
theory
will just
paper.
add one word to it. Sir has said it is descriptive and it is structured. For example, apart from being a descriptive thing, it is structured. You write the definition, you write risk factors, you write pathophysiology, then you write the clinical presentation, diagnosis, right? Investigations involved, and so on. So it has to be very structured, like we do it in the class itself when we teach you a topic. We
Yes.
start from the base, maybe teach you even the relevant anatomy, relevant physiology, maybe integrate. Then they go or build it further into a clinical part, right? So that's how the theory exam is.
Yes. And but when we are preparing for an MCQ exam, that entire structure gets disrupted. It is not necessarily every question will start from epidemiology, pathogenesis, clinical features, signs, symptoms, and all those things. It would all, some questions will be directly asking management, some will be asking the symptoms, some will be asking the cause, genetic involvement, drugs. And usually, what I've learned over the years is this question paper would have four choices, and these four choices will be close together. For example, if you have to make, and I'll ask you in the chat box also, if you have to make four choices, first choice is silicosis. What will be the other three choices? Even without thinking, other choices has to be asbestosis, berylliosis, bischnosis, other occupational lung diseases will be given as the choices. And people who are doing well in a competitive or a MCQ based exam or a multiple choice question, they, even if they don't know the entire description, they know the differentiation. They know maybe for asbestos, the patient has to be a shipyard worker. The upper lobe is more involvement in silicosis, lower lobe in asbestosis, pleura is involved more in asbestosis, tuberculosis is more common in silicosis. You know the difference between. So if I was in your place and starting to study for an MCQ exam, the first thing I would do is, and that is what I used to do when I was a student also. Over every page of my book, I used to place a yellow sticky mark where the key differentiating points were written. This is what we teach in DAMS also. Every class, you will see many times, you will see when teachers are teaching, you will find them, they will be very concise. That's the forte of DAMS. But in that page, the entire key features differentiating the closed differentials are always there. So that's
So
the
which
point number one.
means, so which means if we put point number one very carefully, the art of MCQ solving number one begins with knowing the keywords. That's what Dr. Samir is trying to highlight you. Maybe age is the differentiation. Maybe the gender is the differentiation. Some things could be more common, occupational diseases, right? Maybe geographical area is the keyword, right? So MCQ, the point number one, and I think Dr. Sumer is very nicely highlighted, it is actually actually the most important MCQ skill, which is knowing the keywords. बहुत सारे बच्चे बोलते हैं मैम ये तो वन लाइनर है, ये तो फैक्चुअल है. मैं आपको ये बताना चाहती हूँ, ये वन लाइनर नहीं है, ये फैक्चुअल नहीं, ये कंटेंट है, ये आपका कॉन्सेप्ट है, right? What is a clinical vignette? What is an image based question? What is true and false? What is multiple completion? They're all a amalgamation of keywords. जब आप बहुत सारे keywords को मिला देते हो, वो clinical vignette बन जाता है, right? So everyone has to learn the art of knowing the keywords. That is first skill that we are re-emphasizing. You have to pick up those keywords, you have to put them together, make sense out of it, and then narrow your answers.
And that is, applicable for everybody who's, in the beginning of the phase. If you're preparing for 2026 NEET PG, or you're a second year, third year MBBS, fourth year MBBS, this is the most relevant point for you. You have to learn, and that is what the teachers do, and that is what if you're studying with us, at the end of your DAMS copy, at every page, you can start adding those stickies. That will be your thing on the notes. Like, you understand? Like, you have to put some mark of your personality on everything that you do. That is your signature on it. The second point that I wanted to highlight is the art of solving unknown MCQs. This is something I see, a student has asked this question in the chat also, that I see questions which are not, I've never seen how to do it. Now, it is like, when you are at the end of your journey and you're preparing for a competitive exam, you've almost seen all the subjects. Trust me, you've seen them. But still you see questions that you have not heard before. Okay? But when you look closely, it is not that you have not heard 100% of it. There will be some things that you will be aware of. Maybe one of the choice you are aware of, few of the keywords you are aware of. Find a secret entry door to the question. Use this entry. Like, suppose it's like a 4-choice question. I don't know the question. I don't know the answer, but I know at least 0.4 is not the answer, because I've learned this in the class. And it is definitely, after you've studied with us for the entire year, it is highly unlikely that you will have no idea about the question. We've covered everything for you. So at least one choice you can enter. As soon as you eliminate one choice, and you will hear this word from every top ranker in MCQ exam: elimination, elimination, elimination. As soon as you eliminate one choice, your probability of it getting right increases from 25 to 33%. Then you go deeper into it, try finding one more culprit which you can eliminate with all you got, your logic, common sense, translation. And I'll tell you some of the tricks that I use. Suppose one of the choices is saying all patients respond to this drug. We are not gods. Superlatives are usually wrong. All patients in India have tuberculosis. Superlatives are always wrong. If you find a superlative, megalomaniac statement given by the examiner on the, one of the choices, this surgery is 100% effective, all patients die. It doesn't really work out that way. Medical science is a game of odds ratio. You win some, you lose. You don't have such high things most of the times. There could be exceptions. Don't catch me on this one. But usually these superlative statements are the ones which you can rule out. And then you reach to the final two. That is where the game is. So my answer to you is start eliminating even if you see the unknown questions. But one of my line is that you have to start doing it in the grand tests. Don't wait for the final exam to do it.
I will also add to this second tip. Okay, so the second tip that we are doing is, fair enough, ma'am, we know our content, but what if there is a MCQ which, we feel that this topic we haven't covered, it was not a PYT, something that I probably missed out. So, what I have seen is when students see this kind of a topic or a MCQ, they tend to leave it. What they say is, okay, maybe I'll leave it because then, kahin negative na ho jaye. So I have always seen that when you see such kind of things, Dr. Sumer was absolutely right. Don't assume that you don't know it. Please see the options. A lot of times, even if they're giving you a vague topic, you will realize the options were very, very conventional. They were coming from only basics of anatomy, basics of physio, or basics of that, that area. So you will realize with your basics, you will be definitely be able to rule out majority of times 2 options. And there is a probability that you will be stuck with 2. But even if you feel that you don't know the topic, please go to the options. Majority, and I promise most of the times the basics will be able to solve that particular MCQ. For example, I'll give you an example as well. एक बारी एम्स ने पुराने में एक बार SLE in pregnancy पे क्वेश्चन पूछ लिया था. Now it is stupidity. We are not going to read SLE in pregnancy. There is so much more to read in pregnancy. When we saw the options, it was not a gynae question at all, a ROBS question at all. The only thing that question wanted you to know was your pharmacology. So the only thing you have to know is you won't give methotrexate to a pregnant woman, right? So it was really not about SLE. And what was your take? Oh, ma'am, a question on SLE came. हमने तो पढ़ा ही नहीं था. It never needed SLE in pregnancy. It all needed awareness of drugs which could not be given in pregnancy and which could be given in pregnancy. So, you have to assume with the fact that the topic may seem vague, but the options would be doable with your basics. Right? So this is very, very essential. The third, MCQ skill that we will talk about, which is, I think, common to everyone. Ma'am, दो option तो जैसे आपने कहा, we are able to rule out, but we are stuck with two. अब क्या करना है? So I will ask Dr. Sumay to go first, and then I will tell you what do you do when you are stuck with two options.
See, when you're left with the final two options, you are at the 50-50 probability ratio. Don't mark it at 50-50. 50-50 is not a good idea. You have to now think in your head, can I increase the weightage towards one of the choices by some logic? You understand? Now try to understand. You look at the question. Now there are two choices. I want to eliminate them. There is a chance that one of them is correct. Now I have to find reasons in the question and choice favoring either of the choice, even if they are unsure reasons, because you are not sure. That is why you are asking me right now. The sure hote to abhi tak kar chuke hote na. You are unsure in that question. So you don't have a sure thought to it, but you have a probability thought to it. You have to add a probability points to the choices. That यार शायद इसका सोडियम कम है, शायद A की तरफ ज्यादा जा रहा है, थोड़ा सा, and now that ratio becomes 55-45. That is when your regression happens. That is when you favor the 55% question. It is not like inky, pinky, ponky, po, A, B, C, A, B, A, B, A. Or you do the she loves me, not. No, it's not like that. You do it like, tell me, you try and find reasons which could be vague, which nobody believes in. Maybe even it's just that the name is, or the translation of that word favors this answer, whatever. But you have to increase the probability ratio from 50-50 to 60-40, 65-35. That is the surety levels that you have. And the toppers, what they're doing is, that is what Madam said when she meant about aggressive approach. Now, you will see it in this INICET paper also. All the toppers would attempt more than 190. It's not that they know 190, they know maybe 180. In the final 10 questions, they're able to do this probability adjustment. It is all happening at a subconscious level, because we have been teaching for 2 decades or 2.5 decades now. We are able to articulate it. It is the thought is that I am at two choices, and this would happen in your entire life also. You meet two people, you meet two people. You have to have your subconscious to nudge you that, okay, this one is better for me, and there will be some subconscious reasons, and those subconscious reasons you need to find in your MCQs also.
Okay, so yes, so what will be my take on when you are stuck with two options, which one to go with? I do it fairly simply, okay, and it has really worked for me all across. What do I do? So I've ruled out two options and I'm left with two. Now, generally seen, when I'm left with two, what happens is, मुझे ऐसा लगता है A तो सही है, ठीक है, मगर B में, this is what my mind does, B, this is an INICET paper. Maybe the question is tricky. Maybe the answer is not C. Let's look at B. B may, okay, if it is like this and then that happens, oh, then B is also true. And because it is INICET, it is a twisted paper, I think the answer is B. So what have I done? What I have done is, yes, I've done overthinking. Okay. So when you are stuck with two options, there is one which apparently seems correct. Okay, when you read it on the go. There's another one which you've tried to prove correct by putting in ifs and buts and connecting one thing to the other and indirectly reaching to an answer where it also becomes correct. Then do not go with the one where you've done a lot of thinking. Go with one which was more apparently correct right in the first go, right? Because that is usually the one which is fitting more appropriately, it's more common, or probably it is what you see more commonly, right? And that's what answers are also based on, right? So when you're stuck between two, don't go with the one where you overthink. Go with the one which seems more apparently correct. Okay.
And now I come to the third point, which is very important. I see a query on it as well. It is about silly mistakes. The point number three is you need to avoid making errors on the concepts that you know. Like, for example, something was taught to you in the class, something was taught to you in DVT, something was taught to you in your grand test or in your DAMS CBT. You saw that question. And you are seeing a same question or a similar question in the exam and you get it wrong. It is called a silly mistake. So the rule that we follow is if it is a direct question from the classes, use the method of first instinct is always correct. Because it is not your instinct, it is a subconscious memory that was created during the class, during the interactions, during the teachings, and during your MCQ solving, live videos. You do so many things with us, and so many different kind of methods we reach out to you in our online classes. So I'm sure those are the ones which are tickling your subconscious and converting into your first instinct. Go with it. If it is a direct question within the exam, go with the first
Yes.
instinct.
Yes.
But if it is an indirect question, go with the method of elimination that we already talked about. So, any take on silly mistakes from your side?
Yes, I'm going to add. I'm going to give you a typical example. Again, INICET ka question hai. Okay, there was a question, a very simple question on pregnancy. There were two options, which I don't know why students did it wrong. So one option said each trimester will have, 14 weeks. And then there was another question which said, or there's another option which said EDD is calculated from the last day of LMP. Now, look at this. Option B is apparently completely wrong. You never do it from the last day of LMP. It is always from the first day. It's a very basic concept. You cannot do it wrong. But still, you know what you do? You say, oh no, this is INICET, right? Look at option A, how tricky it seems. Each trimester 14. Then you will say, no, we know each trimester is 12 weeks. That is India. Okay. In US, or according to American guidelines, the first trimester is up till 13 plus 6. हमारे यहाँ 12 weeks तक होता है, right? So this is the kind of error you do. Because of overthinking, you did a very apparently correct answer wrong. ठीक? So this is what I want you to avoid. This you also call a silly mistake. Right? Now, this is one type of silly mistake. Now I'm going on to the next MCQ skill. Right? Now, as students, and I understand, मैं भी आपकी जगह होती तो यही करती. Silly mistake is our defense mechanism. Okay, very, very often you come back from the exam, you calculate your scores, and then you say, "Oh, I've done a lot of silly mistakes." Because this is our eventually, in the beginning, I don't want to accept my mistakes. I don't want to say that, oh, I've performed not up to the mark. So I say I was good, but I got confused. I did silly mistakes. मगर बहुत सारे silly mistakes, और ये preparation time में important है, are actually not silly. They were probably lack of content. For example, some people go and confuse dinoprost and dinoprostone as same drugs. They do it wrong. And then they say, oh, it was a silly mistake. I didn't read properly. It was not about reading properly. Probably you didn't know there are two different drugs with two different uses. Right? So there is a difference of only ONE1, but it is not a silly mistake. It is a content mistake. So when you are doing your practice MCQs, please do not think of every mistake as silly. Become critical of your mistakes. See, look at them. Was it really a silly mistake? Or be truthful. यार ये मुझे आता ही नहीं था. Yes.
So I'll
And
add
because
a line to it. Add a line to it. Very important. It's not just the content. It is also lack of revision. So that is why
yes,
when you're
probably a
preparing,
recall error.
when beginning your preparation, you need to make a plan for your last week and last day. भाई आखिरी हफ्ते में क्या करोगे? What will you do in the last week? What will you do multiple times in the last month? That is why if you notice in DAMS, we filter out your content from your regular classes and then we created live rapid revision and then we created DVT. DVT is a booklet that you can do in last 7 days. Now, if I go through DVT 7 days, 7 days, 7 days, 3 times, 4 times before the exam, it gives me confidence that I've seen the high yield in all subjects, and I'm unlikely to miss out on any usual thing and avoid those recall errors that you had the content. Like ma'am said that sometimes the silly mistakes are happening because you're unable to recall. Why you're unable to recall? You're not revising, and why you're not revising is because you did not plan it in the beginning of your journey. And also you need to plan for the last day. every time you're doing a grand test, my suggestion to you is every time you're doing a GT, listen to the video solutions of your mistakes. Keep a copy with you, which is called as the wrong diary. Jot down those important points that you were missing out or what you were mistaking in the wrong diary. Use it for your last day. Wrong diary should be revised before INICET paper. Wrong diary should be revised before
Absolutely.
NEET PG, before your DAMS CBT. Make it a habit of looking at your wrong diary so that those wrongs don't happen again. That is integrating a part of revision into your journey.
Okay, yes. So I will just add the point of wrong diary here, right? Wrong diary may, I usually ask my students to make 3 columns. The first column is very specifically the mistakes you have done. The second column is your recall or factual errors. And the third column is something new that you came across in your grand test or another paper, which means a new topic. The third column has to be the least extensive one. Okay, whatever extra topics are coming, don't try and do a research work on them. Just focus on points given to you in the video discussion and stick to it. For the second column, which is factual, I want you to write the facts that you're doing wrong in the wrong diary itself. Ab meri baat suno. The set of notes will have a lot of facts, but are all facts equally important? Are all facts clinically relevant? Are all facts in the current pattern of the exam? No. And that is why you have to trust the grand test, the mock test, the transformed NET test, these SWTs to know which out of these so many factual things, which ones are most important. So if they're coming in an exam, they are important. If you're doing it wrong, they become even more important for you. You need to revise them. So then you put them there itself in the wrong diary. As far as the first column goes, which is very specifically write what you have done wrong, and this is where you falter. बच्चे कहते हैं मैम मुझे फोमो होता है मैं पूरा टॉपिक ही दोबारा पढ़ लेता हूँ ना बाबा ना, ये तो नेवर एंडिंग प्रोसेस बन जाएगा और उससे आपकी गलती सॉल्व भी नहीं होगी. So you don't have to read the entire topic again. Just focus on the area that you did wrong. If it was risk factors, only focus on revising that. If it was pathophysiology, only on that. If it was drug or dose, only that. That's how you will be able to do multiple revisions and increase your width of wrong diary jo aap cover kar sakte ho, right? So please follow this.
I think that's very beautifully put. And also remember, एक बच्चे ने मुझसे पूछा था कि सर मैं wrong diary मेरे दोस्त की देख लूं, गलत. Wrong diary should be your own because that is your wrongs that you want to make it right, individualize it. And finally, we want to add few more things. I have seen many children, despite doing all of this, they falter in the exam because of poor time management, because of the exam day anxiety, because of things that happen in the exam hall. Desensitize yourself, give more and more grand tests, be decisive during the grand test, manage your time well in the GT, appear for the DAMS CBTs in the exam environment so that you get desensitized. Every time you see the CBT in the exam center, you see other people, you get used to it. The real exam should feel like a GT. It should feel like a DAMS CBT.
Okay, there's a very important query. Dr. Smith, if you can highlight by Dr. N. Ma'am, are the GTs and MCQs made by faculty? And this is how DAMS stands apart. Every test paper at DAMS, whether it is a GT or it is an SWT or it is a mock test, if it is a transformed NX test, right, TND, everything is done by the subject faculty. They contribute, so they know. For example, अगर हम obs and gynae का GT बना रहे हैं, मुझे पता है what I have covered in GT1. So in GT2, I'm not going to repeat. I'm going to ask you things that I feel, okay, these are also the other important ones. In GT3, I will know, okay, this is a recall error my bachas do, so I will put that. Right? So we know how to give you the correct coverage through the set of GTs that we put, through the set of various tests we put. And that is exactly why, it becomes very, very effective. That is why we match closest to the real exam difficulty scenario. ठीक है. फॉर एग्जाम्पल एक बच्चा मुझे मेरे टेलीग्राम पे पूछ रहा था, मैम आजकल आप आसान क्वेश्चन पूछ रही हो, थोड़े मुश्किल पूछो, INICET पूछो. तो मैंने उसको बोला, मेरे बच्चे तेरे को शायद पता ही नहीं है कि पैटर्न क्या है ना. सो क्वेश्चन इज नॉट अबाउट मुश्किल, क्वेश्चन इज अबाउट हाउ ट्रिकी द ऑप्शंस वर, वेदर यू वर एबल टू इंटीग्रेट और नॉट. राइट, आज रात को 7 PM आई विल बी डूइंग द INICET PYQ का बाप ऑब्स्टेट्रिक सेशन. And tomorrow 7 PM live on eMedico's app, I will be doing the INICET PYQ ka BAP gynecology session. And you will see that we will make it most effective with authentic answers, with explanations, and with predictors, right? So do meet me live today at 7 p.m. for the special PYQ Ka Baap 3.0 session, obstetrics, 7 p.m. live, okay?
Finally, to conclude today's session, MCQ is just a skill. Once you acquire this, you stop becoming afraid of it. There are a few softer things to it, which I will conclude the session with. One, don't think about the outcome during the exam or in your preparatory phase. Don't think about your past mistakes or past defeats. Many children they come and say, "Sir, NEET UG खराब हो गया था, NEET PG भी खराब हुआ." ऐसा कुछ भी नहीं है. Sir, मैं FMGE नहीं हो पाएगा, ऐसा कुछ. Don't label yourself. Don't rule yourself out. Go with an open mind. Tell yourself, I have full chance of winning it. So mindset will be managing. You're closing the past circles and detaching from the outcome. Focus on the day. Give the best exam of your life. Come back with no regrets. Don't let the negativity of the world hit you. People will say negative things closer to the exam on social media. ये तो rat race है, ये तो rat race है. नहीं, तुझे तो जीतना है ना. अब उनकी सुनो कि मैं एग्जाम की तैयारी करूं. So it is, वो philosophy बाद में डिस्कस करेंगे. Do you understand? After you have done your exam, हम सब बुड्ढे होके बैठे होंगे, आपस में बैठ के पार्क में बैठ के डिस्कस करेंगे क्या करना है. अभी तो तुझे जीतना है. तेरा 1 महीने बाद एग्जाम है, मैं तेरे साथ खड़ा हूं. Let's win it all out. Stop thinking about the outcome. Stop thinking about the past. Only focus on giving the best exam of your life. Create options for you. Go ahead and do it. We are with you. Wish you all the best. I hope this session helps you into preparing for MCQ exam. We wish you all the best. Keep rocking. Keep reminding yourself, अपना टाइम आएगा नहीं, अपना टाइम अपन
खुद लाएगा. Okay, one last query. Yashvi, beta, yes, usually the PYQ ka Baap sessions are at 9 p.m. But I'm going to start at 7 p.m. Okay, because the number of obstetric questions is vast and I just have 2 slots. So that is 1 slot for obs and 1 for gynae. So we will be starting at 7 p.m. for both obs and gynae sessions. Okay. So see you all in the evening at 7 p.m. for PYQ ka Baap 3.0. Lots of love. Have a wonderful day. तब तक अपना मिशन INICET पढ़ो. आज मॉर्निंग में ऑब्स्टेट्रिक्स, उसमें मेरे माइंड मैप्स हैं और दे आर वेरी नाइस. मैंने बहुत मेहनत से बनाए हैं, वो सच में बहुत अच्छे हैं. Please use them. Mission INICET OBS and Gynae would be a game changer for anyone who does it. I promise that. Okay, so take care everyone.